Hey, it's Shona on your Channel 4, 104.8, and I'm about to catch up with Dr. Adel Quttainah. He's a cosmetic and reconstructive plastic surgeon. He's got more than 20 years of experience in the field. Hello, doctor.
Hello.
So my first question for you today is, what is a facelift?
A facelift is a surgical procedure, facial surgical procedure that is done to try and counteract the signs of advanced aging on the face. So it reverses the signs of aging, like the redundant neck, toric cheeks, saggy eyelids, saggy eyebrows, jowling, all the signs that come with aging.
Thank you so much for that information, doctor. Who is a suitable candidate for a facelift?
Usually the best candidates for this kind of procedure are people from the ages of 45 to 55. Having said that, there's exceptions, of course, especially the younger ages. Is like, you got patients that lost a lot of weight, or, patients that the genetics are, not favorable, patients that, been, subject to the elements, lifestyle. So we do facelifts on patients that are even in their late 30s. Patients above the age of 55 also, of course, suitable candidates, but, their results are not long-lasting as the patients that we do in this kind of bracket, 45 to 55.
Amazing. What are the types of facelift procedures exactly?
There's many, facelifts have been there's so many names, like mini facelift, liquid facelift, lunchtime facelift, ponytail facelift, smash facelift, deep clean facelift. These are all procedures. Usually what happens is when the patient comes in, we see what needs to be done, what areas need to be addressed and what areas don't need to be addressed, and then we do the procedure. So the procedure is actually tailored to the patient. So all these names are basically mean nothing. A lot of hospitals and centers use, terms like lunchtime facelift to make it sound easy. Procedure can be extensive, could be not so extensive.
And doctor, what can be expected before, during and after the facelift procedure?
Before, we prefer patients not to have all these medical conditions that, enhance bleeding during the procedure. Patients that smoke, we ask them to kind of stop smoking. During the procedure is actually it's a 3-hour minimum, 3-hour to 4-hour procedure. Could be done under IV sedation where the patient's kind of awake, or could be done under general anesthesia. After the surgery, it's basically just to, take on antibiotics, painkillers. They're advised to take it easy for the first 2 weeks after the procedure. They'll be socially, they shouldn't be going to any parties and stuff like that. They should be because they'll be bruised, swollen. So they should take it easy at least 2 weeks post-procedure.
Thank you so much. My final question, what are the post-operative care tips after the facelift procedure?
You can go home the same day, but they'll have 2 tubes, small tubes, drains coming out of the back of the head that we remove the next day, so that we give the patient the option of staying the night, and then the next day we take out the drains, or they can go home and come back the next day.
Thank you so much for all that information. That was Dr. Adel Quttainah, cosmetic and reconstructive plastic surgeon with more than 20 years experience in the field. You're on Channel 4.